Well, we're joined now by Upstate University infectious disease specialist, Dr. Stephen Thomas. Thanks so much for joining us again, Dr. Thomas. Always good to catch up with you here.
Hi, good evening. How are you?
Good. Well, a lot of the talk now is focused on this phase one. Will it be Friday? Will it be Saturday? It's going to be coming at some point. How thin is our margin for error when we're in this first phase, whenever that does start and proceed?
That's a good question. So, you know, the State Department of Health has laid out very specific criteria that a region must meet for to be able to open up and to be able to go through these different phases. And so when we talk about the margin of error, it depends on what specific category are you talking about, and it's a day-by-day assessment. So if you're talking about the decline in total hospitalizations, or the decline in the number of deaths, or your hospital capacity, or your intensive care unit bed capacity, the answers could be different. Based on the New York State regional scorecard that's available, on the web, Central New York is doing quite well in most categories except one, and there's planning and thoughts about how we're going to overcome that, that seventh category.
What is your level of concern, if that's the right word? I don't want to put words in your mouth, that we get to phase one, we start the economy back up a little bit, that people are just going to go, we've conquered COVID-19, we're good, we're restarting the economy, and we kind of let down our guard?
Well, I mean, it is a big concern, and of course, you hear on the national stage, Dr. Fauci testifying today that it's a concern of his. But again, as I've said before, there's going to be a new normal, and this is not a virus that we're going to kind of, in a pandemic, we're going to live through. This is something we're going to have to learn to live with. And so as we, meet these criteria, as we enter into the different phases, we need to recognize that the virus may still be circulating, that people can still get infected, and we have to remain vigilant. Just because we can kind of take a new posture of, okay, we're going to start opening up low and slow, it doesn't mean that we have to take our eye off the ball and recognize that there's still virus circulating in the community.
Dr. Fauci actually testifying from home in front of the Senate, warning of suffering and death that could be avoided and of further economic damage if states reopen too quickly. Are we opening too quickly here, or are we doing it at the right pace when phase one does happen?
So I think that the criteria that the state has laid out are very reasonable criteria. They measure things that truly reflect what kind of transmission is occurring and what the burden of disease might be and infection might be in a community, and therefore the healthcare infrastructure within that community. So I believe that if we as a region can meet those criteria, then it's reasonable to start thinking about, again, in a phased sort of low and slow approach, reopening. Again, I come from the perspective that this is something we're going to have to learn with, because I don't see it going away completely anytime soon. But again, we have to remember that the virus is still going to be here. There are still going to be people who are getting infected, and we need to have systems in place, which we do, that when little fires break out, we can take care of those little fires so they don't coalesce to become one big uncontrollable fire.
I think there are some people who think we'll get to phase one right away to 2, 3, 4, and man, maybe by August we're fully reopened again. Is there any kind of talk about status of a vaccine? Is that anytime soon, or is that still a long way off?
Right. Yeah. So that scenario that you just laid out there, I don't think is a scenario really based in reality. So the way that I think it's probably going to play out is, again, in a low and slow and informed way, we're going to enter a phase. We're going to open, up in a controlled manner. We're going to observe what happens. We're going to reassess. Then we'll slowly transition on to the next phase, and we will kind of repeat that cycle. A vaccine solution is really not going to. We really should not be thinking that that's going to be available for at least a year, and maybe even longer. And as we've kind of spoken about before, it's a very complex process, and even when everybody is thinking about it and everyone's focusing their resources on it, and the regulatory agencies like the FDA are focused on working with developers, There are still steps that you have to go through to ensure the safety of the public and to ensure that the vaccine does what it's supposed to do. So working in parallel, but it's going to have to be good public health interventions and a slow phased approach, which is going to carry the day in the near term.
Last one for you, and this one always strikes me, and we're part of it. We report it. We hear X amount of people have recovered and were released from the hospital. And I know it varies from person to person, but when we say released, does that mean they just all bounce back to 100%? Or what does recovered even mean with COVID-19?
Right, so that is a good question, and you're right in that it's a case-by-case basis. So again, as we've talked before on your show, we have very young people with no underlying medical problems who get very severe COVID infections. And so in that demographic of patient, the ability for them to rebound after that infection could be brisk. And they could, in fact, after that initial period of illness, bounce back to where they were pre-illness. While some of the older folks and the folks that have other comorbid conditions such as diabetes or heart disease or COPD, for example, they may end up in the intensive care unit. And then after they're well enough to leave the intensive care unit, they could end up on a general, like a medical surgical floor. And then after that, they may end up needing to go to rehab. And so it can be a very, very slow and very long process of recovery for patients. So we do say they recovered when they can leave the hospital and go to a rehab or if they're lucky enough to go home. But it is not a quick process at all for many of these patients.
Dr. Thomas, I have a list of questions I still want to get to, but we've run out of time for tonight. Yes. So I will save those for the next time when you join us, and I know you will. Thanks so much for being with us tonight. Appreciate it.
Thank you.
And for more information on the coronavirus, including a county-by-county breakdown, head to localsyr.com and the News Channel Line app. Just click on the coronavirus banner on the homepage.